The Leprosy Mission Nigeria (TLMN) says approximately 2,500 new cases of leprosy are discovered annually in the country. Dr. Sunday Udo, the national director of the mission in Nigeria, said that for more than 10 years, the mission had found and equally treated thousands of leprosy cases in the country.
Leprosy Mission Nigeria, TLM for short, is an NGO called to serve those who have leprosy. We work in about 30 countries of the world, including Nigeria. TLM actually works in collaboration with the Federal Ministry of Health. We actually work in partnership with the National Leprosy Control Program. So that's a national program that we support. And every year we find approximately 2,500 new people that have leprosy in this country. And over the last, I would say, 10 years, we've treated and we've found, thousands of cases, tens of thousands of cases treated, equally that large number. But the interesting thing is that there is a large backlog of those who have already developed disabilities. And they run into hundreds of thousands of people. And what we do is to support them with care after cure. We provide them with disability services. We provide them with complication management from the disease across the different referral centers that we have in this country. So that's what we do as a leprosy mission. And of course, we also try to support their livelihoods because of the stigma. Many of them lose their jobs, and so we try to support them to, get back their livelihoods. No, like every other disease, not just for leprosy, every other infectious disease, eat well, avoid crowded areas, exercise, do the normal, regular things you do to boost your immunity, and you won't catch leprosy. Just like you won't catch other diseases if you do the same thing. There's no special thing you have to do, to prevent you getting leprosy. No. The good thing is that at least more than 90% of the population is protected from leprosy. It doesn't fly in the air like people think. It's not contagious. That's what I mean. Yes, it's infectious. That means from person to person, but it's not contagious. It's not like COVID, where once you come close, you are likely to get it. No, it takes quite a long time to contract the disease.
Okay, so what do you have to say to the government to support the Leprosy Mission Nigeria?
Yeah, I think for the government, for me, I think they should keep doing the good things they're doing. Keep supporting the national program. There's also a national leprosy technical working group on leprosy. They should keep supporting that and ensure that once we reel out policies, they should pick it up and expand it and uptake it.
Thank you very much.
Thank you. I'm Dr. Sunday Udo.
Thank you so much.
Thank you.
Thank you so
Thank
much.
you.
Thank you, sir.
Program Officer TLMN Great Britain lauded the leprosy mission in Nigeria for its valuable impact in the lives of those affected.
We first have regular communications with the team at the Leprosy Mission Nigeria. We can't do this without them, obviously, because they do all the hard work. We review the performance against achievements towards the targets and the budgets. We do project visits, we meet with partners, we meet with project clients to hear about the things that have gone well and the things that have not gone so well and why and what we can do about it. And then we work together to adapt any of those project activities accordingly. We also act as the liaison between the project and the donor, Comic Relief. We do the reporting along with the team here in Nigeria. We approach Comic Relief for any approval for any changes that we want to make and any discussions like that. The relationship that we have with the Leprosy Mission Nigeria is so valuable, I can't put it into words. The Leprosy Mission Great Britain has focused more on the physical aspects of leprosy. So we've supported health services, we have hospitals, we do operations and those kind of things. And open minds was the first project dedicated entirely to mental health. And its success has benefited, obviously, all the people that we've heard about so far this morning. But it goes wider as well. We're now planning on incorporating mental health and inner well-being in lots of new projects that we fund at TLM Great Britain. It's in our new strategy, and we're not only funding new projects, but also funding research into the most effective ways to support people with them.
Mr. Shehu Alta, Kebbi State's Tuberculosis and Leprosy Control Program Manager, appreciated the Leprosy Mission Nigeria for its support to the Kebbi State government.
Yeah, first of all, I want to appreciate the Leprosy Mission Nigeria because this is the first non-governmental organization that is supporting my state, even before the coming of a TB program. They have been supporting leprosy activities in the state, and also they have included non-neglected disease NTDs in our program. With the coming of this program, mental health and leprosy, before now, we will treat leprosy patients. After treating them, we'll do socio-economic rehabilitation to them. But one aspect of life that we didn't realize was the mental issue. But when the Leprosy Mission come with the issue of mental health, that is when we recognize that people affected by leprosy and other entities are suffering from depression and anxiety. And that has helped us now to control level of anxiety and depression among people living with leprosy and neglected diseases.
He urged the government to be responsible and involved in the formulation of infectious diseases and programs and projects, as well as partake in their execution and implementations.
Government need to take ownership of this program because you see now the Leprosy Mission will come for meeting of close-up meeting for the mental health, and we realize the importance of mental health among people living with leprosy and neglected disease. So the government have to come on now to to sustain the program from the Leprosy Mission and let them, like for my state, it's two LGS that are benefiting from the program. So we need to expand it to the remaining 19 LGS, and the government should take ownership of the program so that all these people affected by leprosy and other diseases should benefit from mental health issues.